Podium to address the state once again here, giving us an update on the latest spread of the coronavirus. Let's listen in.
The spread of this virus that has so profoundly impacted people all across Tennessee. I want to just start out by reminding people all across Tennessee of something I've said multiple times before, and I'm not going to stop saying it. It is personal responsibility that will slow the spread of this virus. We can do a lot of things in government. I'm going to talk about a lot of things we're doing to help people and to help slow the spread and to provide for more supplies and equipment and prepare for what's coming. But what's going to slow the spread of this virus are the people of Tennessee taking individual responsibility. That's why social distancing really does matter. It really does matter. It matters that people wash their hands. It matters that they stay home. You know, we have a disproportionate number of positive tests. Almost the vast majority of our tests in Tennessee are for those under 40 years old. To the young people in Tennessee, it matters what you do out there to attack this virus spread, because people are dying in Tennessee as a result of COVID-19. And more people will if we don't personally address the changes that each one of us need to do. You know, if you own a restaurant out there and you're still trying to get away with serving people in a dining room, it matters that you're still doing that. If you're a church and you're not figuring out how to allow your people to worship in a way other than just crowding in together, if you're a rural church out there who thinks it doesn't matter what happens in rural Tennessee because the virus may not have shown up in your county yet, it matters. It matters every day that we take responsibility, and staying apart is a part of what every one of us can do. It's your role and your responsibility. We, in fact, are coming out with a new public service announcement campaign today called Do Your Part, Stay Apart. You'll see TV commercials with Maria, my wife, and I telling people to stay apart, do your part. But you're also going to see some famous people that are right here from Tennessee that are a lot more well-known than the governor and first lady. They have all volunteered celebrities to join in and remind all of us how important this is. That public service announcement started today and will spread all across this state, and we appreciate those who have donated their time, generously donated their time to do that. I also want to give a couple shout-outs to some companies. I like to do this every day because there are more and more Tennessee companies who are participating and helping in the effort. We're all in this together, and we're going to get through this all together, and we're grateful for companies like Kirkland's and Jackson and Nissan, who are two companies, examples that have given thousands and thousands of masks that are so important to protect the health of our healthcare workers. So we commend those companies and encourage other companies to join in and provide supplies and equipment. I showed the other day an example of innovation and creativity in our state and how we're coming together to figure out ways to attack this. Lowe's has donated Tyvek material, which serves as an appropriate material for gowns when treating a COVID-19 patient. And inmates in our Department of Correction are actually putting those gowns together and sewing them at Northwest Correctional Institute. And our model here will show you our example of this, and these are actually going to be gowns that will be used by healthcare workers to protect them and keep them safe. They're telling me you need to come right over here to show it. This will be used by our healthcare workers to keep them protected and safe while they are protecting COVID-19 patients. So we are very grateful for Lowe's for doing that, and we're also very grateful for the men and women in our correctional institutions that are putting these together. Thank you very much. Got to have a little fun with these. It's a very serious subject, but we're grateful for the work that folks are doing together. All right, so today I'm going to talk a little bit about not just the health effects of this, which are the most serious component of the spread of this virus, but the effects of that spread, and one of them is unemployment. As we know, we not only have a healthcare crisis in Tennessee, we have an economic crisis in Tennessee, and it's one that we take very seriously and that we
Hi there, folks. Sorry about that. There's obviously some audio complications here in the midst of Governor Bill Lee's daily briefing to the state of Tennessee. I'll go ahead and recap while we get this reconnected as to what he's shared so far. He's only been talking about 10 minutes. At the moment, he has kind of given shout outs to some Tennessee companies who are helping to the effort, contribute to the effort to keep our healthcare workers safe on the front lines. There we go. We're going to listen back again to where he is giving credit to both Kirkland's and Nissan, as well as Lowe's and folks in correctional facilities putting those
I'll talk a little bit
outfits
about
together,
that
if I may call it, the
I want to talk
protective
about
equipment.
executive
So let's keep
order
listening
that I
in
just
to Governor
signed
Bill Lee.
today that will expand the capacity of healthcare workers in our state to meet the anticipated growing demand for healthcare workers. And I want to talk a little bit more about testing. And I have with me today, because we're talking a lot about unemployment and about the health component of this, Dr. Piercy from our Department of Health is here, and also Dr. Jeff McCord from our Department of Labor and Workforce, as well as members from our Unified Command Team in case questions come up for them in the Q&A period. Our case count today is 957 positive cases confirmed out of 14,909 tests. Our testing capacity continues to increase rapidly. As I said yesterday, and it still holds true, we are testing at a rate per capita much higher than many of our peer states. We're proud of that, but it's not good enough. We're going to continue to expand testing because the more people test, the more we know who is sick, and the more we're able to address that appropriately. I want to talk about unemployment. I was on a phone call yesterday with representatives from the hospitality and the entertainment industry across this state, business owners who employ hundreds of thousands of workers in our state. And I went through with about 15 of them on that call to talk about their individual hospitality and or entertainment companies. These are hotel owners. These are Gaylord to Dollywood to multiple hotel chains, restaurant chains, individual restaurant owners. The impact of this virus on that particular industry, the segment of industry, is overwhelming. We have thousands and thousands of workers losing their jobs every day, and that has a powerfully negative impact on the lives of Tennesseans. We, in fact, through Department of Labor and Workforce, reported that last week we received 39,000 new unemployment claims in the state of Tennessee. Now, to put that in perspective, the week before, we received 2,700 new unemployment claims, 39,000 this past week. That is a 1,300% spike in unemployment, and we know that it actually is going to increase as the weeks move ahead. There are profound implications to the spread of this virus, which is why it is so important that each of us do our part to look beyond when this virus is ravaging this state at its highest point. And we can make that happen more quickly by following the individual responsibilities that we have given as guidance and that actually have been a part of the national conversation. So we're doing everything we can to give folks relief in this unemployment arena. Last week I signed an executive order that would reduce the regulations around applying for that unemployment benefit. The state is spearheading a public-private partnership with the Tennessee Grocers Association and Convenience Store Association, Tennessee Retail Association, and Hospitality Tennessee to create something we're calling the Tennessee Talent Exchange. That partnership is going to provide an opportunity powered by jobsfortn.gov. The goal of the exchange is to provide an opportunity to match Tennesseans who are out of work because of COVID-19, match them with companies that are, in fact, currently experiencing a surge in business and making immediate hires. We've all heard that the grocery business is actually in need of workers. There are other companies in our state that, in fact, because of the changes in the way people are buying things across the state, there are companies that are hiring. So we want to create an opportunity for people that have lost their jobs to find those companies that are hiring, and that is available at jobsfortn.gov. Labor and Workforce is a part of this, and they have modified the workforce development website to quickly post job openings and match job seekers. So we want to continue to work with business leaders to make sure that their companies can endure and weather this pandemic, but we want to work especially with those who have lost their jobs and make sure that they too can weather the storm. Again, Labor and Workforce Commissioner Jeff McCord is here to answer further questions in the meantime. Let me say one other thing about that. As we all know, there is a significant federal funding package that is in Congress right now. Passed the Senate last night. It awaits approval and passage in the House for tomorrow. We certainly hope, for the sake of America, that that bill gets passed and that relief funding begins to make its way to the states. That relief funding will provide quick relief to businesses and to individuals. It will provide quick targeted dollars at fighting the spread of the virus itself. And I just want Tennesseans to know we don't know the details of that bill yet because it hasn't passed Congress yet. It'll be up for a vote tomorrow. When it does, we'll know the details of it. But I want you to know that in our unified command, we have already put in place structure, a finance structure, and put together a team and are working on the specifics of that team, but it will include the legislature, the comptroller's office, the governor's office, accountability structure that will make certain that when that money comes to Tennessee, it will be directed in the most effective and efficient way to help small business owners, individuals, entrepreneurs. It will help alleviate the unemployment challenges that we face, the uninsured in this state. It will be targeted to help individuals, businesses for economic relief, and it'll also be targeted at our efforts at providing expansion of PPE, medical supplies, hospital beds, and expansion of hospital personnel. So we are eagerly anticipating that. We anticipate it will come, the vote will come tomorrow, and then we'll have much to report about in the days ahead. Today, I signed Executive Order 20, which will further mobilize more healthcare workers. It loosens restrictions around retired medical professionals to allow them to come back into practice without the time frame required previously for them to come in, without the restrictions around that. We've also temporarily suspended continuing education requirements for those practicing in the healthcare field so that they can continue to serve patients and not have to take time out to get continuing education. In an effort to improve access, we've called for access to patients and yet maintain social distancing. We've allowed for the availability of phone assessments for individuals with mental illness or emotional disturbances. Mental health will continue to be a priority for this administration through the pandemic, and we want to make sure that people can access mental health services without having to come into contact with a mental health service provider. So that is made possible through this executive order. It also expands telemedicine efforts. All licensed providers now may use and utilize telemedicine in serving their patients during COVID-19, as long as they're practicing within their normal scope of practice. Those are a few of the multiple details in this executive order number 20. The broad scope of that executive order and the broad effect of that is that it will allow us to put more healthcare workers into the system as we anticipate that need for more workers. And again, I want to commend our healthcare workers who are putting themselves on the front lines, who are taking care of the patients they traditionally do, and now are faced with the COVID-19 patients that they have as a result of the spread of this virus. We will enter into the actually, I want to ask Dr. Piercy to come up and give a health update, and then Commissioner McCord give an unemployment update, and then we'll offer time for questions. Dr. Piercy.
Thank you, Governor. We do have 957 cases today. You'll notice that that's a big spike from yesterday. That is not unanticipated. That is just simply reflective of the time delay that some testing is experiencing right now. A bit of good news is that, as the governor mentioned, we have ramped up our testing availability, and that capacity will continue to grow. We're very pleased in Tennessee that on a per capita basis, we continue to outperform many of our peer states. And we do think that will add to our social distancing efforts when we're able to correctly identify, isolate, and quarantine those at risk. Otherwise, our deaths remain stable at 3. Our hospitalizations have gone up some, but still remain lower than 10%, again, likely because of the lower age population.
Hello, I'm Jeff McCord, Commissioner of Labor and Workforce Development, and as the governor mentioned, we are in unprecedented times, setting records that we don't want to be setting. We are like the rest of the country in not only the volume, but the suddenness of the volume. And we have done on the front end some policy changes, but also we can't do business the same way that we're doing it now. So on the process side, late last week, we began transitioning some of our resources, some of our people resources to help with the claim process. And so today we have 100 more people than we did Monday actually working on claims. We have also upgraded our systems late last night so that we get more timeliness on the system side. And also working with our employers to do partial and mass filing claims without going into it. It reduces the cycle time that people are going to get the benefits that they're owed, which remains our 2 primary goals. One is to be able to accept claims easily, and secondly, to be able to pay those who are eligible fast. So we are working towards that. And again, as the governor mentioned, seeing opportunities to transition employment. We are, with the Tennessee Talent Exchange, we can move people to jobs that actually do exist while we're experiencing the job loss from other industries.
Thank you, Dr. McCord and Dr. Piercy, and we have others here as well to answer questions. So why don't we move into the question phase?
All right, at this time, we'll go ahead and proceed with questions. First up, we'll go Natalie Allison with the Tennessean. Natalie, your mic is unmuted.
Hey, Governor.
Hey,
I know that you all are still awaiting information about the federal bill that's moving through Congress, and you alluded to more information coming from that. But at this point, based on what you do know, what can you tell Tennesseans who are small business owners about what they could potentially expect, and what will the state's role be in allocating that money? Can you talk a little bit more about what you do know at this point?
Yeah,
and how soon that money could be coming down? They said it could be a couple weeks.
Yeah, that's right. We expect that there'll be guidance on it quickly. The actual distribution could be a couple weeks. And it's very hard to speculate on what that relief might look like. We do know that we believe that it'll be somewhere between $2 and $3 billion for our state, which is a significant amount of money. But as you know, when you consider unemployment claims of 40,000 a week, those are big numbers, and there are huge economic losses associated with what's happening across this state. We have hotel companies that are operating at 10% capacity. We have We have major entertainment companies in the state that have laid off 90% of their workers. And so not only do you have costs for businesses to survive, the businesses themselves to survive, but for the workers. So it's hard to know what it's going to look like. We do know that the numbers are significant, somewhere between $2 and $3 billion. We do know that there will be some portion of that allotted to larger cities. We don't know the size delineation, but it's likely that our major cities will have direct funding, and then the state will take the remainder of that funding and determine a strategy for distributing it out to the communities. We do know there will be small business relief. We do know there will be opportunities for unemployment benefits that are significant. We think there will be actually relief for all sorts of businesses across the state. There also is a great deal of funding directly related to the costs associated with providing the increased services to deal with the health crisis that we face. So, as you know, the state is working very hard to access additional hospital beds and to bring those online. That comes at a great cost. We're creating a pooling resource for healthcare workers. We are purchasing, as you know, we've already purchased millions and millions of dollars of PPE, and we have just begun to purchase that equipment, from ventilators to personal protective equipment to a number of supplies. We've got temporary beds through the Department of Military. So there's a lot of money that will be required to address the health side. A significant amount of this funding will be for small business relief, and that will likely come in by way of grants to small businesses that will help them in the period of time with which they either had to have their business closed down or the vast majority of their revenues were closed. Those are the types of things we know are coming, but the details we won't know until the bill's passed and delivered to us.
Next one.
And if that is, can I ask a follow-up, Joe?
Yeah, go for it.
Okay, and if that is delayed for a couple weeks, is the state prepared to start helping with any of that in the meantime, or is everyone sort of just going to have to wait until the federal government sends them?
You know, we're talking about that very thing today. Of course, we have a significant unemployment trust fund reserve that is paying unemployment benefits right now. The federal government, for example, is planning to add to that benefit. So we will likely pay the benefits and the relief that the state is currently providing, and that added benefit will probably not come until the money comes from the feds. Same would be true with SNAP benefits. There is likely going to be some increase in the way SNAP is paid out. We're paying those benefits now. We're paying TANF dollars now based on the traditional levels that we currently do, and the numbers of those claims has been significantly higher. So the state is already paying out significantly more than it has been in recent years. But we will wait before we start paying out the increased amounts. We'll wait until the federal government financing comes.
All right.
Thank you, Governor.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your mic is unmuted.
Hey, Governor, thanks for doing this. Just had a question about the testing site at Baylor School. First, your thoughts on that, and also if there are other plans to do something similar across the state.
Yeah, I'll let Dr. Piercy answer specifically, but my initial, the question is about Baylor and a specific testing site. So what happened is the federal government released and relaxed their regulations around testing, not to diminish the quality of tests, but how those testing facilities can be given permission or license to operate. And they gave the states permission to do that. It's one of the things the federal government has been doing, is relaxing regulation as well. So they gave states the ability to license and bring testing facilities online. We knew about this one in Baylor. I'll let Dr. Piercy address the specifics about the one in Baylor, but it's been a success story in that we've been able to bring on additional testing that wasn't available before. You want to add a couple comments to that?
Thank you, Governor, and thank you for the question about Baylor, because it gives me an opportunity to brag on a school that's doing something very innovative. This high school has essentially a molecular biology lab, and they have PhD professionals there that are perfectly trained and adequate to supervise this lab testing. They're using the CDC-approved testing, and as the governor mentioned, the FDA allowed us some flexibility to approve some of that at the state level. We worked all weekend to help speed that process, talking to many folks in Chattanooga, and we're very excited to have that lab online and encourage any other similar institution that is interested to apply.
Next, we'll go to Travis Lawler with the Associated Press. Travis, your mic is unmuted.
Hi, Governor. You talked about Lowe's donating Tyvek, and I've heard from doctors that the Department of Health has advised they should use bandanas, scarves, even diapers in lieu of respirators and other workarounds. And these doctors, they're literally risking their lives. Do you think these makeshift protections are acceptable?
Well, fortunately in Tennessee, we're not having to utilize makeshift. Tyvek is a moisture repellent product that is adequate for a gown for providers, and we won't use Tyvek Tyvek gowns until we've run out of the gowns that we would traditionally use. You hear about a lot of makeshift things happening, but there's not a makeshift happening in our state yet because we have stayed ahead of the curve on masks, the appropriate types of masks, the appropriate types of face shields, the appropriate types of gowns. We have enough respirators. So, I think when people end up in a situation where they got to do what they got to do to save a person's life, that's when makeshift happens. We don't want to get to that spot. We want to use the right equipment, and that's our plan to do so. And these gowns are approved for use. So we're gonna stay ahead of that.
Next, we'll go to Josh Smith with WJHL. Josh, your mic is unmuted.
Governor Lee, thanks so much for taking time to answer questions. I'd like to understand more, if you could, about your thinking regarding increased actions to require people who live in Tennessee to stay at home. Here in rural Northeast Tennessee, the Regional Health Office said yesterday for the first time they're now seeing community spread of the virus. The dean of Quillen College of Medicine here at East Tennessee State University said this week he believes it's time for government leaders to issue a shelter at home. Why don't you think that some sort of shelter at home or statewide shelter in place is the right thing right now? And what would have to happen for you to change your mind on that?
Yeah. I get asked about that quite a bit, and we certainly, as I've said before, there are 18 or 19 states, maybe 20, I'm not sure, that have shelter in place. There are another 30 or so states that don't, and there's a reason for that, because leaders and governors all across the country know that it requires real data and input and evidence in order to make decisions that profoundly impact a society. And that's how I view this. About 50% of our population are in this state, are under stay-at-home requirements. And those populations are in the most densely populated areas of our state, which is what makes sense. I've commended the leaders from those communities who have chosen to use a more aggressive stay-at-home policy for the protection of their citizens. I've commended them, and we are working together to have an overall strategy. There is not a one-size-fits-all policy in this country for what is the best way to approach this. And what's happening in in a rural county or in your district is different than what's happening in downtown Nashville. And that's why you have different things going on across the state. But as I've said before, I talked to epidemiologists, 5 of them yesterday, as a part of understanding what we believe is happening across this state. And I'm talking to business leaders all across the state, and I'm talking to governors all across the country. And every single one of us is working as hard as possible to create a strategy to mitigate the spread of this disease to the degree that it's possible, and to mitigate the economic damages as well. So there's nothing off the table, and every day the numbers change, and decisions will be made based on evidence and data.
So accurate to say you're open to it, just not right now? Is that an
that's
accurate
right.
description?
Yeah, that's right.
All right, thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your mic is unmuted.
Governor, how you doing today?
I'm well, Sam. How are you?
I'm hanging in. Hey, I understand that there are some states that are making projections on the number of cases and severity, and wonder if Tennessee is able to reach that point, and if not, come up with some sort of model for projections. Why not? Because wouldn't that help you prepare?
Yeah, I've actually worked with, have requested and am working with Vanderbilt to get a projection right now that's unique to Tennessee. There are a lot of projections out there, and they are all over the board, and they're not helpful because they're all over the board, and they're based on a number of different states and different populations and different densities. And so I have asked for a modeling that is unique to our state, and we think we'll have that model within a day or so. That'll help inform decisions around next steps.
And how decisions?
I'm sorry?
How will that shape your decisions on what you do?
Well, we'll know a little bit more about the projected number of cases, potentially, hospitalizations, the need for bed capacity, how the projected quantities of hospitalized patients over a certain period of time will match with the capacity we have for hospital beds, for example. All of those things are connected to personal protective equipment, number of ventilators. It also might give us some information on where we can expect the greatest outbreaks. Certainly we know that Nashville is where the hotspot is right now, but there may be other places that modeling will show movement. So there could be a number of things that it would inform.
Thank you.
Next, we'll go to Stacy Case from Fox 17. Stacy, your line is unmuted.
Thank you, Governor. Does your PSA go far enough? Thousands of doctors and nurses are signing a petition asking you to issue that statewide stay-at-home order just to clear any confusion.
The public service announcement?
Yes. Does it go far enough? Doctors and nurses are asking that you sign that stay-at-home order to clear up any confusion. They're afraid people just won't stay at home.
Yeah, well, we are encouraging people to stay at home at every turn. You can't get into people's homes and find out what behavior they're having, but we certainly can encourage them to do it. And we can every opportunity we can through public service announcements, through stay-at-home restrictions that we have in our major cities across this state and in multiple other areas in Tennessee. There are a lot of things that we can do to encourage people to stay home. At the end of the day, Tennesseans are going to have to take personal responsibility to protect the lives and the health of their neighbors. That is what is going to turn the tide for this, and I'm proud of the way Tennesseans have responded, but we have to become even more responsive, and I believe that's going to happen.
Quick follow follow-up. We're hearing of a backlog of tests in the private labs. They're days, if not weeks, behind getting the results back to patients. We're hearing from people who got a test last week, for example, and don't have their results. Are you aware of this, and what are we doing to fix that?
Yeah, Dr. Piercy might add to this, but we do know that with the ramping up of testing, so we're getting more tests out there and more people are getting tested, and that has in part contributed to the fact that test turnaround time is slower. But there's a new technology coming on board actually on Monday that will allow a series of our tests to have a 45-minute turnaround. There's another technology that gives an hour turnaround. So as testing increases and as new technology is brought on board, I think we'll see those numbers change. But we are aware that when we really ramped up testing, what we did was ramp up the load. And actually, it's national. There is these labs are, many of these private labs are receiving tests from states all over the country, and there's been such a push to increase the number of tests in this country, which is a very good thing. But one of the unintended consequences of that was longer lag times on the results of those tests. I think we'll see those improve as well. Dr. Pierce, you have anything to add to that?
Thank you, sir. So I want to be clear that for high priority tests, we are still able to test those in the state lab. You'll notice on our website that we can keep that supply chain going. We're looking forward to having what we call point of care test, which removes the need to have to send that swab out and have several day delay, can actually have that point of care result where you can get test results back in the same day.
Next we'll go to Eric Helt with News Channel 5. Eric, your mic is unmuted.
Good afternoon, Governor. Here in Nashville, we have several testing sites that have the workers, have the PPE, and are ready to go, but don't have the testing equipment, specifically the swab. Is that an issue that you're seeing statewide, and when can those testing sites expect to have that equipment available?
You know, what I would say is that we see spots statewide. So there are locations that are struggling with a particular component of the testing supplies. I will say that statewide, though, our testing numbers are increasing every day, and the supplies necessary for those tests are increasing every day. So what we have is, on balance, an improvement all across the state, but in particular spots, we have some challenges. Is there more to add to that? So I have heard, and we do know about particular instances in Nashville, but there are a number of facilities coming online. And by the way, we are, beyond your specific question about Nashville, the National Guard today, as was said earlier, has been deployed to stand up really and support 15 or so remote assessment facilities across the state, and that's happening as we speak. So the ability to assess and test is rapidly increasing. There are going to be some challenging spots, and apparently that's happening in some test sites in Nashville.
Finally, we'll go to Jason Reynolds with the Murfreesboro Post. Jason, your mic is unmuted. Jason, we can't hear you. If you could speak up, please.
Okay, I'm here. I'm sorry. I'm having some troubles on my computer. You mentioned national testing sites, but in Rutherford County, they've not been listed on the Department of Health webpage for having any testing sites. There were some briefly, I think it was last week, and then the county came back and said, no, those aren't available anymore. Do we have any testing sites? And if we have tests here, how many tests do we have in the county?
I'm going to let Dr. Piercy answer that question for you.
Thank you for the question about Rutherford County testing. I want to reassure you that there are multiple providers all across the state, both in clinics and in hospitals and health systems that are providing tests on a daily basis. That's why our first advice is to always call your provider if you think you need a test, to not only be screened but also to be directed to where to go for testing. As you mentioned, there are some remote assessment sites, and as supplies wax and wane, sometimes those sites come on and off the list. But you always call your provider, and the health department in every county has the ability to test. The 35 sites that the governor mentioned are ramping up today, but that's just a supplement to what we've already been doing. So we have not heard of any particular shortages specific to Rutherford County.
That's all the time we have for questions at this time. Governor, would you like to make the closing statement?
Yeah. Thank you all for giving us the time. Thank you, Tennesseans, for responding. For those who, I'll say again, for those who haven't taken it serious, it's time. It's time that we do that. Look at the numbers changing. It's time that we do it. So step up, do your part, and stay apart. Thank you for having us. We'll be back again.
So you've just listened to Governor Bill Lee reiterating the new mantra that is going to be out in public service announcements here. Do your part, stay apart. You're going to see it. He's very serious, making sure that everybody is getting the message here in our state. The governor gave lots of shout outs to Tennessee companies doing their part, including Lowe's and Kirkland's, Nissan sharing their equipment, creating some of the personal gear to keep our medical professionals safe. Discussed unemployment, the 39,000 new unemployment claims applied for in Tennessee just in this last week, and announcing the Tennessee Talent Exchange, which I just tried to get online to see the kinds of opportunities that this is providing those who don't have jobs, those of you who lost their jobs, and trying to match Tennesseans with those businesses that are actually experiencing a surge in this coronavirus pandemic. So the website to go to, keep checking it, is jobs4Tennessee.gov, jobs, the number 4, tn.gov, and you should be able to get through. They just say there is quite a wait at the moment, but make sure you're taking note of that. I want to talk about stocks right now. They're surging again on Wall Street as this relief bill gets closer to passing Congress. So look at that, up 22,000 points, or up to 22,000 points right now. So that brings the S&P as well up 17% since Monday. The astonishing rally came even as this massive scale of this downturn slamming the economy becoming more apparent. So nearly 3.3 million Americans applied for unemployment benefits across the country last week. That shattered the record in 1982 that was set. So we're going to continue to watch this. Of course, the big bill, the $2.2 trillion bill passing last night, heads to the House for a vote tomorrow. We have got all the updates for you. Continuing information on News 4 at 4 o'clock here in just about 15 minutes. You can get everything you always need, though, WSMV.com, as well as on our News 4 app. We will be back, and we will see you at 4 o'clock.
Red wine. All of that liquid has absorbed. See this? This is what you're looking for. That means most all of the alcohol content is cooked away, and the meat